freelancing entrepreneur, people yourselves or people you know, how important or how much of a factor is health insurance in your lives? I guess what I mean by that is the decisions you make about jobs or chances or other things. I don't know, healthcare, a big topic on your mind?
I mean, for me, just because of the line of work, that I'm in, and I even look around the studio and I think of other photographers, people I know in work in television and in the creative class, if you will, and health insurance is a huge issue because so many people, I don't know about you guys, but I mean, if you're not full-time employed somewhere, that you don't have health insurance, and so you have to seek it on your own. When you're a woman, that makes it, I've been through this myself because I left the firm I was with, started my own business, and I was buying my own health insurance for a good period of time, and it's absolutely scary. Breast exams aren't covered, maternity care isn't covered, and it's terrifying. And I know that people who work in this kind of field, this is make or break why they decide to have certain careers that maintain the careers that they have or move into something different.
More expensive for women.
Yeah,
absolutely. Oh yeah, absolutely.
Yeah, having worked in healthcare a little bit, Casey, I mean, it really is important. And one of the things I was kind of shocked to see a couple weeks ago was that there's a projection right now that health premiums by, I don't know, 2 decades from now, they estimate that they could be as high as your average salary for the year. And so it's something where we're already seeing costs like this where, I mean, it's hard for an individual to afford, let alone a family. And so it's a huge decision for anybody.
Yeah, I think from my experiences in healthcare, I'm a medical student and I happen to volunteer at a clinic on the weekends, and it's one of those places where you see really the impact of not paying for care that's cheap now, that's going to be really expensive in the future. I think one thing that people talk about when we talk about Medicaid is what's fiscally responsible. And I think what's important for people to realize is that, we can pay a couple of cents now for drugs that will prevent complications down the road that maybe not in 10 or 15, but 20 years down the road, there's serious implications that may cost hundreds of thousands of dollars. I think if you think Missouri is going to be around for 10 or 20 years, which I hope it would be, you plan for that long-term cost.
Right. I mean, I just.